Before starting the video, please complete part 1 of the survey below, then return and press play. Thank you. Alright, let's begin. Have you ever walked into a room and forgotten why you went in? Now imagine a day when someone can't remember their family, their friends, or even who they are. For many elder adults, memory slips happen more often, and they can be an early sign of Alzheimer's disease, the most common cause of dementia. Alzheimer's can affect memory, language, and orientation, and for most people, symptoms first appear after the age of 65. You might feel far away, but the global impact is already huge. In 2019, an estimated 57.4 million people worldwide were living with dementia, and research suggests this could rise to about 153 million by 2050. According to the WHO, Alzheimer's is estimated to account for roughly 60–70% of dementia cases. So the number of people affected by Alzheimer's-related dementia is likely to be enormous as populations age. Hi, I'm Billy. In this video, I'll explain how Alzheimer's progresses, outline key risk factors, and highlight practical actions that may help lower risk and support brain health for you and the people you care about. Alzheimer's is complex. It's a disease of failing brain communication. Neurons pass messages through tiny connections called synapses, forming networks that support memory, language, and thinking. In Alzheimer's disease, two protein hallmarks develop abnormally and disrupt these networks. First is amyloid-beta. It can accumulate outside neurons and clump into plaques, often because it's produced in excess or cleared too slowly. Plaques can activate the brain's immune cells, which may drive chronic inflammation and further stress nearby synapses. Second, tau, a protein inside neurons. In Alzheimer's, tau becomes abnormally modified and it detaches and aggregates into neurofibrillary tangles. This creates a transport traffic jam, reducing delivery of nutrients and signals and weakening neuron structure. Clinically, Alzheimer's progression is a continuum, from hallmark accumulation causing silent brain changes to mild cognitive impairment, and finally late-stage disease, where synaptic communication significantly decreases and full-time medical care is often needed. When networks become less connected, symptoms begin to appear, often starting with memory difficulties when changes affect the hippocampus and medial temporal lobe. As more brain regions are involved, different functions can be affected. Damage to temporal frontal language networks can contribute to communication problems. The effect on frontal lobe can impair judgment and emotional control, leading to confusion or behavioral changes. And involvement of the parietal lobe can affect spatial awareness, navigation, and hand-eye coordination. As these changes build up over time, the brain can become less able to cope, especially in areas involved in memory, language, and navigation. So if these are the kinds of changes happening in Alzheimer's disease, what might make the brain more vulnerable to them in the first place? One important part of the story is overall health. In modern life, conditions such as type 2 diabetes, high blood pressure, and high LDL cholesterol are becoming increasingly common. Research reviewed in the 2024 Lancet Commission identifies these as modifiable risk factors for dementia. As Alzheimer's disease is the most common cause of dementia, these factors are also relevant to Alzheimer's risk. Here we'll focus on type 2 diabetes. In type 2 diabetes, the body's cells become less responsive to insulin. This is called insulin resistance. As a result, glucose can stay higher in the blood for longer. Over time, this can affect blood vessels, increase inflammation, and place extra pressure on the brain. So how might type 2 diabetes be linked to Alzheimer's disease? A useful way to think about it is through three systems the brain depends on: energy use, blood flow, and inflammation. First, energy use and signaling. Insulin does more than regulate blood glucose in the body. It also helps support brain metabolism and synaptic function. In type 2 diabetes, insulin-related signaling in the brain may become less effective, which can place stress on synapses over time. Second, blood vessels and clearance of hallmarks. Type 2 diabetes can damage small blood vessels and affect the blood-brain barrier, the protective filter that helps regulate the brain's environment. Research also suggests that disrupted vascular insulin signaling may be linked to amyloid pathology and to less efficient clearance of hallmark proteins. Third, inflammation and oxidative stress. When blood glucose remains high over long periods, it can promote chronic inflammation and oxidative damage, adding further pressure to already vulnerable brain cells and neural circuits. Taken together, type 2 diabetes does not directly cause Alzheimer's disease on its own, but it may create conditions that make Alzheimer's-related changes more likely or more damaging over time. So, what actions can help? The good news is that the basics are simple and they work best when they become steady habits over time. Stay active. Regular movement supports circulation, mood, sleep, and insulin sensitivity. Even small amounts can help when done consistently. Eat for brain and heart health. Aim for more vegetables, whole grains, beans, fish, and unsalted nuts, and fewer highly processed foods. Prioritize good sleep. Sleep is when the brain restores and resets, so protecting sleep is also part of protecting memory. For many adults, around 7 hours of sleep each night can help support overall health and well-being. Manage the key health numbers. Blood pressure, cholesterol, weight, and blood glucose all matter, especially if you already have diabetes. And finally, stay socially and mentally engaged. Social connection and mental activity can help support well-being, resilience, and brain health. If you're worried about your memory or if you have diabetes and want support, an important next step is to speak with a healthcare professional or contact the Alzheimer's Association for help. Thanks for watching this video. Please like and share it to help more people learn about Alzheimer's disease, and don't forget to complete the survey below to share your feedback. Thank you.